Hello, everyone. I'm Susan with Indiana Ship. I'm joined by my coworker, Megan Rogers, and Megan is going to talk to us about how Medicare covers home health care. But before she begins, I'd just like to give you a couple of reminders. We are coming to you live. However, this is recorded and it will be on our Facebook page for a month. And then we will also post it on our YouTube channel. So if you think you need a refresher, or maybe you know somebody that this information may help, just have them look us up on Facebook and YouTube. If you would like to comment questions in, do that. We'll keep an eye on that, even if it's not live, because Megan and I keep tabs on our channels and we will answer your questions. Well, without further ado, Megan, thank you for putting together this great presentation.
You are welcome, Susan. Let me get my slides up here. All right. So Medicare does cover some home health care if you need it. It's very specific, so it's important that you understand what is covered and what is not covered. So both are original parts of Medicare. A and B do cover home health. If you have an Advantage plan that bundles your A and your B benefits, that is covered as well through your Advantage plan. Now, these are the types of home health services that you can get under your Medicare. Medically necessary part-time or intermittent skilled nursing care, physical therapy, occupational therapy, speech therapy, medical social services, part-time or intermittent home health aid to help with bathing, injectable osteoporosis drugs for women, durable medical equipment, and then medical supplies that you might need for your skilled nursing care. So some additional examples of the skilled home health is wound care. So if you have pressure sores or a surgical wound, patient and caregiver education, maybe on how to change those dressings or how to give specific medications, intravenous or nutrition therapy, injections, monitoring of a serious illness, and unstable health status. So when you have home health staff in your home, they should be checking to see what you're eating and drinking and that you are eating and drinking. Checking your blood pressure and temperature, your heart rate, and your breathing. Check that you're taking your prescription drugs and maybe over-the-counter supplements or pain meds and any other treatments that you should be doing at home. Checking your pain levels, making sure that your home is safe. Do you have grab bars where you need them? Do you have throw rugs throughout your home or apartment? If you do, the throw rugs are probably one of the first things they're going to tell you that need to go. Teaching you about your care. So making sure you know when to take your insulin, when to weigh yourself, when to take all your prescriptions. Do any prescriptions interact with each other? Recently, my brother had surgery and he got sent home with tons of new medications. And I was the one to fill up the medication pill box. And one of his medications said to take it 3 times in the morning. But then the printout we got from the hospital said to take it 3 times at night. Now, medicine doesn't always, it doesn't always really matter if you're taking it morning, noon, or night, but depending on the type of medicine or the other medicine you're on, it could. So I called the nurse care manager to make sure we knew when to give it to them. So that's an example of something the home health aide or nurse might do, is making sure that you understand when to take your medicine and there's no discrepancies on the paperwork you have on when to take medicine. And they're going to coordinate your care, making sure you know when all your doctor's appointments are, when your therapists are coming, when you have tests, when you need to get medication picked up. So the goal of home health under Medicare is to get better, to regain your independence, to become as self-sufficient as possible, maintaining your current condition or level of function, and to slow any decline of health. So there are some types of Medicare or some types of home health that Medicare does not pay for. Medicare will not pay for 24/7 care in your home. It will not pay for meals to be delivered to your home. Now, there are some Advantage plans that do have temporary Meals on Wheels, home delivered meals that they cover, usually after a hospital stay or a nursing home. But it's a very specific type of food, usually like frozen meals. So no DoorDash or Uber Eats. And it's short term, so maybe 2 days, 5 days, 3 days. Medicare will not cover home health or homemaker, excuse me, services. So no one to send out to do your shopping or your cleaning. Now, if you do have a home health that will come in to help you bathe once a week while you have physical or occupational therapy, and a nurse, when they are done with the shower, they may help you clean the bathrooms or taking out the trash related to that, or helping you get dressed. And then no custodial or personal care that helps you with your daily living activities. Except, I know my husband's grandfather, he had frequent UTIs, so he would get home health ordered to help with his balance. So he'd have a physical therapist, an occupational therapist. He would have a home health aide that would come once a week and help him with the bathing. And when they are doing the bathing, when they're done, they will help you get dressed in that circumstance. And then a nurse to come out and monitor your medications and your health conditions. So who is eligible for home health under Medicare? So to get home health under your A and or B, you do have to meet these conditions. You must be under the care of a doctor or another allowed practitioner, and you must be getting services under a plan of care created and reviewed regularly by a doctor or allowed practitioner. You must need, and a doctor or allowed practitioner must certify that you need one or more of these. So either intermittent skilled nursing care or physical therapy, speech therapy, occupational therapy. Now, these services are covered only when the services are specific, safe, and effective treatment for your condition. The amount, frequency, and time period of the service needs to be reasonable, and they need to be complex, or only qualified therapists can do them safely or effectively. To be eligible for the therapy, your condition must be expected to improve in a reasonable and generally predictable period of time, or you need a skilled therapist to safely and effectively make a maintenance program for your condition, or 3, you need a skilled therapist to safely and effectively do maintenance therapy for your condition. And then the final qualification you must meet is you must be homebound, or a doctor or allowed practitioner must certify that you're homebound. So what does it mean by being homebound? So this means not necessarily that you can only be at home and you can't go out ever. It means that you need the help of another person or medical equipment such as crutches, walker, wheelchair, to leave your home, or your doctor believes that your health or illness could get worse if you leave your home. And it is difficult for you to leave your home, and you typically cannot do so. So what if you really do need to leave your home? So even if you're homebound by the previous definition, you can still leave your home for these specific reasons: medical treatment, so doctor's appointment, tests, lab work, religious services, or to attend a licensed or accredited adult day care center. For some non for some special non-medical events that may count as well for short periods is if you have a scheduled family reunion, a funeral, graduation, or occasional barber or beauty parlor trips. So what will home health cost you? So if you have original Medicare, it's a $0 copay for these covered home health services. After you meet your Part B deductible, 20% of the Medicare approved amount for Medicare covered medical equipment. So if they recommend durable medical equipment, grab bars, canes, walkers, wheelchairs, bedside commodes, toilet risers, or bath chairs, after your deductible is met, there is a 20% copay just for the durable medical equipment. Susan, do we have any questions yet?
We do not so far.
Okay, thank you, Susan. So, as I have gone through the slides, these are very specific short-term home health needs. So what if you need more care or different kinds of care than what Medicare will provide? You can always private pay for additional home health services. Medicaid may come in and provide some home health if you have long-term care insurance, Veterans Affairs benefits, maybe asking family and friends to assist, seeing if there's any kind of assistance through the church or state and federal funding. So a good resource to find out what options are as far as home care entities, or if any of these other funding sources would be able to come in and assist if you qualify for those, is contacting your local area agency on aging. The website is listed on this slide. You can always reach out to Susan and I by putting a chat in the chat box or Facebook messaging us, and we can get you connected to your local area agency on aging. They all have resource centers that you can speak to a trained individual who can help you learn about local resources or different funding options for these different services. So besides Facebook, you can also get a hold of us through our SHIP call center, 1-800-452-4800, and they can connect you to either Susan or I or a local SHIP site. You can visit us on our website, medicare.in.gov, and Susan stated that the recording will be on for about a month, but you can also find this on YouTube for much longer. Well, Susan, I am going to turn it over to you to let our viewers know what is coming up next.
Thank you, Megan, and thanks for a great presentation. It was a lot of information and a few short slides, and so that's going to be a very helpful resource. Coming up yet in our Lunch and Learn series next month, because these are a once a month opportunity to learn about Medicare, on May 14th, we're going to talk about hospice care. Hospice care is end of life care, and it does come under the Medicare benefit, but it has some requirements and guidelines, and we will better define what hospice benefits through Medicare are. Again, remember that's at noon on May 14th, noon Eastern time, right here on our Facebook page. And then our more regular opportunities to learn about Medicare are our Facebook Lives. And we do have one more coming up in April on the 20th. And this is going to be all about your Advantage plans. If you have an Advantage plan, how do you make sure it's working for you and you're getting the most out of that Medicare option? So join us at 10 o'clock Eastern Time on April 20th to learn how to squeeze every benefit you can out of your Advantage plan. Thank you for joining us today. Thanks to Megan for a great presentation. And everyone, enjoy the rest of your day.